Good morning, everybody. My name's Nick. I'm a speech pathologist from Calvary Healthcare Bethlehem in Australia, and I'm going to be presenting the results from our recent study titled Invest in Your Voice, How a Novel Co-Designed Voice Banking Service Supports People with MND. Alrighty, so before I continue, I would just very quickly like to acknowledge that our research has been supported by Calvary Healthcare Bethlehem and the Allawali MND Victoria Research Grant. We've consulted with people living with MND ALS, their carers and other organisations, and additionally our speech pathology department has been involved in the research phases and development of the new clinic model. Very quickly, I'm going to run through a little bit about our service. So we're a public health service specialising in progressive neurology and palliative care. The speech pathology team provide inpatient, outpatient and community-based services, as well as offering a secondary consultation service to support local and regional clinicians working with people with MND across the state of Victoria. We're the largest provider of services to the 500 people living with MND in Victoria. An important part of our role is to support people with their ongoing communication needs. And this includes supporting people with voice banking for future use to ensure their ongoing communication and social participation. So we've already heard from John about message banking, which was a very exciting presentation. And I feel very humbled to be here as well after John and before Richard. So what I want to talk about is a little bit about voice banking, which John's already kind of talked to. So it's a process that involves recording a person's speech, which is then used to create a synthetic or digitized voice that can be banked and stored securely for later use when and if required. So rather than using a generic default male or female voice, the synthetic voice can be loaded onto an everyday device such as an iPhone or iPad or a specialized communication device. The output voice will sound like the person's own voice, a factor that we know is critical to the acceptability and therefore the uptake of voice banking. Voice banking's become more accessible, less time-consuming, with many programs now available on the market. However, it remains a complex and challenging space for some healthcare professionals due to the overwhelming number of voice banking services and the lack of evidence to support and inform decision-making and implementation. As outlined by Richard and his colleague Stephen Block, the reality of using AAC and voice banking for communication is poorly understood by people living with MND and healthcare professionals. So why research voice banking? And I suppose we're coming from a bit more of a humble beginning than where John's clinic is at. So historically, there's been very low uptake of voice banking in our service. We know that early uptake is important so that the synthetic voice output will not be impacted by speech changes. You know, if it's done after the onset of speech changes, the quality of the synthetic voice will be impacted and voice banking may not be possible if it's left too late. So previously we trialled providing information using pamphlets and email follow-up, registering clients with voice banking accounts on their behalf. No success. Sending people out headset microphones so they could do the recording at home, also didn't work. And a group delivery format where we had everybody kind of together, where we could set up the recording on their behalf with some staff support, also unsuccessful. So we then realised we needed to partner with our patients to better understand and meet their needs. And so we embarked on a research study back in 2022 to develop a co-designed voice banking service. So just quickly, this is a phase one of the project, which involved survey, patient carer interviews, staff focus groups. The outcome was the co-designed voice banking clinic model that I want to talk to today. We previously reported on this data at the San Diego conference, so I won't spend much time on it now, but here's a summary for your reference. Okay, so in summary, the key elements of our co-design model, which phase one resulted in, included practice change, early referral. So using the phase one results, we developed and delivered an education module for external and external referrers. We also have begun to adopt patient-centered lexicon to talk about voice banking in a positive and acceptable light. And speaking to what John said before, the language of investing in your voice. Establishment of voice banking clinic infrastructure and implementation of a systematic process now underpins our model. So we're using systematic audit steps and detailed decision-making guidelines to contribute to clinician confidence and ease for patients. This involves tailored informational counselling, addressing the knowledge we know our patients want, as well as a demonstration of a clinician's synthetic voice, immediate booking for voice banking with our allied health assistant, voice shaping, and then voice delivery at an agreed time points. Which brings us to today's project. So what I'll be focusing on today is the evaluation. So the first part was a database review, which reviewed the changes in completion rates, rate of uptake, and time taken from diagnosis to recording, and then a survey to better understand the perspectives of people living with MND who have gone through our new model. So, how did things look? Also, how did things change looking at our voice banking database? So this is a like-for-like 9-month period. Pre and post implementation of the new model. Firstly, while we see similar rates of people diagnosed with motor neuron disease to our outpatient service, in 2023, post implementation of the new model, we see a significant change in outpatient uptake of voice banking, with over 20% of all our patients referred to the service completing voice banking. Also, interestingly, we see an incidental shift in the practice in the inpatient service, just kind of by contagion. Despite it not being the focus of the voice banking clinic, which is exciting. Looking at the database review, looking at the change in the completion of voice banking. So for the savvy audience member, you'll notice that there are two very different time periods here that we're looking at. So with the pre-2023 time span, we had expanded it to capture as much data as possible, so it's a 2.5-year period, and also looking at taking into account the impact of COVID at that time. And then the 2023 clinic model, we're still looking at the same 9 months. So you might notice that there's a few more voice banking clinic referrals in that 2.5-year period to the 2023 clinic model, an increase of 337.5%. Completion rates were fairly similar, but improved still in the new model. But the really interesting data you begin to see is the change in how quickly we're offering and then how long it's taking from when we offer the voice banking to completing the voice banking. So down from 158.57 days to just 19 days. And then also the range from a person receiving their MND or ALS diagnosis to the date we're completing voice banking. Down from a median of 462 days to 126 days. You'll notice that huge range, though, in the 2023 clinic model is because when we were also offering this model to people who had been living with motor neuron disease for a long time. Alrighty, so onto the survey results. As you can see, our participant ages are normally distributed and are in line with the literature, where the mean age at onset in sporadic motor neuron disease is 65.4 years. Asking participants to think about, to answer what type of ALS MND they have. This is really actually a bit of an unexpected but important finding, that just under half of our participants didn't know their MND ALS phenotype, which has an important impact on the person's understanding of their own disease. Also, it can impact somebody's uptake of voice banking, as we know that disease progression is an important factor in decision making. Asking people to reflect on how motivated they were to complete voice banking before they received informational counselling. While we see the majority of participants were interested in completing voice banking, under half our participants were actually somewhat or not interested, which raises questions about the types of personal factors that influence the acceptability of undertaking voice banking. Asking people about whether in the new model we provided informational counselling at the right time. Overwhelmingly, yes. And you'll see that the two participants who had said no, they didn't feel the information was provided at the right time, both commented that the information was provided too late, or looked at another way that the speech changes were too advanced. Do you think the information was provided in the right manner? And pleasingly, people felt it was. Getting people to reflect on what piece of information had the most impact on the decision to bank their voice. We see these kind of three themes emerging. So again, going back to the idea of the investment approach being something that people found a really useful kind of way to anchor, I suppose, that decision making, how easy the process and procedure was after having the informational counselling, and the ability to maintain an identity and social connection. Was there any information that had a negative impact on your decision to bank your voice? Most people said no. One person said yes, worried about it being sent to America, which is an interesting finding. I don't know what that says about Australians, but it does also raise questions given its inaccuracy, because the service that we were using, doesn't involve that. So did this person just have pre-existing privacy concerns? And does it highlight an issue with the informational counselling that we were providing? Possibly. So what worked well in your recording session? We saw these four main themes. People identifying the clinician as helpful in the process, the actual interface, and the ease of completing the voice banking, how the voice sounds. And we also just had this nice sort of collection of positive responses, with one person just saying me, as in I was the person that made it good, as in them, which is really probably very accurate. What didn't work well in your session? Three main groupings of themes. We see this kind of emergence of positive or neutral responses where people weren't really identifying that things went wrong. But again, we see people saying the output voice, the presence of dysarthria, they are identifying those as factors which really, sort of did influence their kind of interpretation and experience of that. Asking our participants how satisfied were they with the final product. All but two of our participants in this survey reported that they received staff input to record their voice in clinic. Interestingly, so one of the individuals who completed it at home with family noted that they were dissatisfied with their voice input, namely that it didn't sound like them. And it's I think important here that this was somebody who didn't believe that they completed voice banking too late. So they believed they did it in the right time frame, but they did it at home. And I think it's really interesting to note that perhaps there is really a benefit in considering that people with motor neuron disease, ALS, really do actually benefit from having the right equipment and support and professional guidance to record their voice to improve the fidelity of the final product. When do you want, do you have a preference for download time? And what we see is that most people recognise that after the informational counselling, that when the voice should be downloaded is at the time that it's needed, or that they're happy to be sort of guided in that space. So we see 85% of our individuals in the study recognising that benefit of downloading the voice when or if the need arises. And it confirms that people living with MND ALS, at least after informational counselling, perceive that voice banking is an investment rather than to be something that is immediately implemented. And ultimately, in an Australian context, this would be something which is influenced by funding models and prognostic factors. All right, let's speed up a little bit. Nick, based on your overall experience, did the voice banking process meet your expectations? Pleasingly, most people thought it did. They either exceeded their expectations or met their expectations. I'm going to keep going.
You don't have to stop. You have 5 more minutes.
Oh, wonderful.
Then you will have no questions.
Which I don't think would be a bad thing, actually, for everybody. So, can you suggest asking people to reflect on how the voice banking process could be made easier for people living with motor neuron disease? 6 themes. The environment, increasing public education. Again, this grouping of positive or neutral themes, improving the processes, helping or increasing early uptake, and also looking at how we can improve the fidelity of the final output voice. On to the discussion. So the results we provided today highlight the value of working together with people living with MND ALS to design an effective model that is patient-centred, feasible and efficient. This is important to acknowledge, this was a small evaluation. So the sample size of our participants was 15. That's important to note. But just sort of reflecting on the facilitators that were identified with the new model, so we now have these clear pathways for intervention. We've got human resourcing and time allocation, staff confidence and competence, both in the intervention and in the informational counselling. The user interface and the low time commitment were definite strong facilitators. We've been lucky in terms of, I suppose, the funding systems that we have available that have made it really possible for us to support the download for people living with MND ALS. Onto barriers. Again, we're seeing this satisfaction with the output voice. And so obviously that's a space that we're keen to be looking kind of more into, and obviously an area where there's a lot of work going on. The onset type impacting quality. And I suppose that's important. In our context where we work, the clinic is a management rather than diagnostic service. So, for example, somebody who had perhaps signs starting in the bulbar region, we would be seeing them once those, often when they have quite sort of significant changes. So that's something for us to be thinking about. Hey, how can we support early uptake, considering the entry points into our service? And also, people living regionally, which meant that they weren't able to come easily into our clinic for face-to-face support and guidance. Okay, where to next? We're hoping to continue to translate our findings into clinical practice, particularly looking at early referral and how to improve uptake, streamlining our service delivery from sort of introduction through to voice delivery, continuing to develop speech pathologist knowledge and confidence, introduction of a mobile voice banking clinic, which is pretty exciting. Then this looking at how we support knowledge dissemination. So hopefully, tapping John and Richard on the shoulder, looking at creating a community of practice internationally for practitioners working in voice banking. Looking at how we support local speech pathologists to develop skills and provide them with opportunities in this space. Creating health literate resources for MND associations, for neurologists to be provided early on at suspected diagnosis. Publishing these findings. Also looking at the acceptability, investigating further the acceptability of banked voices, integration of the synthetic voice into social context, use patterns, look at developing a framework that we can help to pilot for other services, and our blue sky thinking is developing an international consensus-based co-designed practice guideline for the introduction and implementation of voice banking for people living with motor neuron disease. And that's the end.
Thank you so much. I'm sure that John and Richard would be happy to talk to you later, take you under their wing. There is a virtual question that I would like to get to before.
This is from Kevin Robinson from Niels. A comment and a question. There seems to be a significant gap in the area of voice banking and messaging when it comes to those of us with bulbar onset ALS. By the time we are diagnosed, have processed the diagnosis, and learned about voice message banking, the speech is already significantly degraded. So the question, where are we in developing the ability to replicate original voice rate, et cetera, from previous recordings patients may have?
Yeah. And this might be a question I might be able to sort of share with John, if that's not to put John on the spot too much, in terms of where that technology is really sort of at and supporting people with MND.
Sure. There is significant ability to take what we call archived audio and edit that and submit that through what is now the double dipping process. So if there is high quality recording and it can be edited and then uploaded into mymessagebank.com, and there's enough quality that then can be downloaded, shared with one of the voice banking companies, and they're able to create a custom synthetic voice from that. It needs to be good quality, and the editing needs to be strong so that it's cutting out other noises, other voices, laughter, speaking a different language, dogs barking, all that sort of thing. But there are many, many quality voices that have been created now out of archived audio.
Thank you, John. And hopefully that's a hopeful, positive response for the questioner.
All right. And do we have time for any more questions in here, Jess? Okay. So we're going to thank you.
Thank you.